his talk.
Good morning, friends. Thank you, Chairman, for the opportunity. The very first requirement in a hospital is that it should do the sick no harm. And this has been the age-old dictum of providing medical care. I'm going to tell you some stories which actually happened in our day-to-day practice, medical practice. You will all know this vivacious actress, but the story is not about her. The story is about her mother, who underwent brain surgery in one of the top US hospitals. And instead of removing the tumor from the right side, the surgical team removed part of the brain on the left side. So wrong side surgery occurs 40 times a week. There's another story. It happened in our country. These images will haunt us for long. The first day post-operative patient being lifted out of the window in a burning hospital. This happened in an accredited hospital. And the story which shook all of us is this incident in Tamil Nadu, where 2 doctors were arrested for a cluster endophthalmitis case. So this actually woke us from our slumber. And these cases abound. Media has a fascination for naming this as botched surgery and giving all sort of negative connotations. So we can't be like this ostrich putting our heads into the sand and keep telling that it cannot happen to me because our hospital maintains all standards and we have the best of all the requirements. Patient safety events can happen anywhere, can happen to us, it can happen in our hospitals. So we have to take care of these situations and see to that how we can act and prevent these incidents. So the basic tenets of patient safety and accreditation are these 6 important parameters. One is safety, avoid harm or injuries to patients. The second one is effectiveness of medication. So this has to be evidence-based. And third, it should be patient-centered. We need to respect the dignity of patients and responsive to their individual needs and values. And timely care provision, reduce delays for the receiver as well as provider. And it has to be efficient. So we have a lot of wastage in our hospitals. So we have to avoid wastage of resources. And it has to be equitable care. So why patients complain? So when these tenets are not followed or perceived that they are not followed, the patient complains. So broadly, we can classify the medico-legal issues that can be prevented as 4 categories. 1, failure to comply with legal and professional responsibilities. The second one is problems in patient safety, medication errors, and care management. Third one is administrative errors. Most of this happens in our reception department or related to billing and tariff. And fourth one is failure of communication, inadequate consent, inadequate documentation, medical records, what the previous speaker elaborated. The first one, legal and professional responsibilities, we need to provide them with safe and hazard-free environment. Of course, when you comply with the legal requirements like fire NOC, PCB clearance, and biomedical wastage, we are relatively safe. And all the more we have to be careful when we provide medications, particularly with safe medication, properly stored, properly preserved, and properly dispensed. So the right medicine to the right person in right quantity. And the next issue is related to the professional responsibilities and problems in patient safety and care. How safety can be supported with standards. So this is the crux of the issue. And if you have proper infrastructure in place, many of the safety incidents can be prevented. A safe hospital is not one structurally strong or aesthetically pleasing, but also has certain functional components like emergency exit system, fire systems, electricity systems, and good water supply, alternate water supply, medical gas, and communication system. If you take many of the negative incidences that happen in the country, most of this will fall into this category. How accreditation standards help is to improve the hospital facility as well as monitor the facilities over a period of time. Standards also ensure disabled-friendly environment. This helps the vulnerable patient who are reaching us, particularly in ophthalmology, have a lot of vulnerable patients. Patient safety and common errors, so right eye surgery being done on the wrong side, wrong dosing, wrong medicine, and also all this occurs, and even though we have enough systems in place to take care, it do happen. And infections again occurred in the hospital. And this is one incident instead of right eye, the left eye being operated. And so another reason why patients sue the doctor is not communicating. So common cause of litigation is this CCC failure. We are used to CCC in cataract surgery, but this CCC is about communication, consent, and complaint feedback system. If you have this CCC well established, then the medico-legal issue can be brought down. The third and fourth category is the administrative errors. So you need to have a standard billing and transparent tariff and the time-related information. So patient flow has to be smooth and uniform across our processes. And one of the common cause of dissatisfaction and regular fight in our hospital is the time taken for care delivery. They perceive that timely treatment was not given. So you need to have a system in place. So when the patient comes, when the assessment is being done, and how the treatment is being provided. The next thing is communication and how we communicate bad news. Very often we have to communicate bad news to our patients. So good communication skills for not only doctors, but also the counselors and nurses, very important. And we have to take a lead in providing this training for good communication skills. So overview, how does accreditation help in reducing medico-legal challenges? Good infrastructure is directly proportional to safety care. Good process, documentation, and good communication skills can reduce medical errors as well as patient safety. And licenses in place ensures that the leaders are not in trouble, and good structure and process give good outcomes. So when our outcomes are good, patients have less to complain. So how accreditation and CPA, medical negligence is not a myth. It happens all over the country. Hospital and doctors lose cases because they do not put up a proper defense or have proper documents in place. And we have to accept this, very poor at documentation and communication and crisis management. This is where we have to improve as a skill. And we are timid. We don't really face the cases properly because we don't have systems in place. When we have systems and process in place, we can be bold and boldly face any negligence cases. So that's it from us. The best way to predict your future is to create it, and one way of creating it is having a proper accreditation system and preventive mechanism in place. Thank you very much for your kind attention.
Thank you, Dr. Fredrick. The next talk is on professional jousting by Dr. Pankaj.